Stakeholders in the Yobe health sector converge on the Emergency Operations Center in Damaturu, the state capital, to disseminate the comprehensive emergency obstetric and newborn assessment report. The Director, Family Health, who doubles as the state coordinator of the Seaman in the state, gives an overview of the assessment.
We have about 10 modules, where these modules, I think, they are the one that will be used at the national, also at our zonal training before we embark on the Seaman facility assessment. So healthcare, one of the thematic is healthcare workers' competencies, while in the module infrastructure, amenity and referrals, also human resource for health. In module 1, if we talk about overview of the health infrastructure. In module 2, we are taught general maternity walkthrough. Then module 3, overview of the neonatal unit infrastructure. Then overview of the pharmacy laboratory in module 4. Then overview of the human resource for health and performance in module 5. Then maternal and newborn neonatal health services management, including quality of care improvement in module 6. Normal labor and delivery and essential newborn care in level 7. The management of obstetric complication in level 8, module 8. The management of newborn complication and cesarean section in module 9 and module 10, respectively.
Dr. Sikiratsu Kailani, a consultant of obstetric, expresses worry over the maternal mortality despite huge investments by governments and partners.
The maternal mortality in Nigeria is the worst worldwide. We are second only to India, but our population is not proportionate to India. And if we must reduce this bad stigma, we have to start. Dr. Aisha mentioned that nations are rated. Whether a nation is a good nation, is a viable nation, it's the mirror with which that nation is looked at are the maternal and child indices. And all these indices are worse.
The Commissioner for Health in the state explains that the administration of Governor Mai Malabuni has come up with policies to bring healthcare services to the people's doorsteps.
We recognized this as a problem since the inception of this administration. And of course, that is why when His Excellency came into power, he took it as a policy to approach the reforms of the healthcare system through a health system strengthening approach, and starting with improving access to healthcare services, bringing healthcare services to the doorsteps of the people.
Development partners who spoke through the representative of the United Nations Children's Education Fund pledged to support the state government in achieving its universal healthcare coverage.
If you look at the NDHS, Yobe State has the highest fertility rate in Nigeria. Now, with these expectations, with these figures, we should also expect increase in maternal and child morbidities and mortalities. So we would like to congratulate Yobe State for this proactive initiative towards addressing maternal and child morbidity in the state.
The data from the assessment is expected to be integrated into planning and policy formulation for maternal and newborn health programs of the state.